Greetings and welcome to Understanding and Managing the Challenges of Caregiving. At this time, all participants are in a listen-only mode. If you have not already done so, please close all of the programs on your computer. You may submit a question via the web at any time by using the Ask a Question feature on the left side of your screen. If anyone should require operator or technical assistance during the conference, please press *0 on your telephone keypad. It is now my pleasure to introduce your host, Jennifer Gillette. Thank you. You may begin.
Thank you, Roya. Welcome to everyone to our final evening of the Caregiver webinar series. We hope these programs have educated you, provided new resources, and validated your role as the caregiver. I am Jennifer Gillette, Staff Social Worker at the National Bone Marrow Transplant Link, and we would like to thank all of you for joining our program. Tonight's presentation was designed to help you understand and manage the challenges of caregiving. As a reminder, this presentation will be available on our website within a week. You may also request a copy of the slides by emailing us or by attaching your contact information provided at the end of this webinar. Just in case some of you are new tuning in this week, we want to make sure that everyone knows about the link. The National Bone Marrow Transplant Link has celebrated its 25th year anniversary this year and is dedicated to the service of helping individuals and their families from diagnosis through survivorship. We work with hospitals, cancer centers, and other organizations to reinforce and complement medical care by providing resources, support, and education. Some of our programs include our chronic graft versus host disease telephone series and webinar support, our caregiver series, which you are a part of this evening, our peer mentor program for patients and caregivers, Second Birthdays Recognition Program, our resource books, materials, and referrals. And again this week I would like to highlight our resource book, which is an excellent guide for contacts on many of the common concerns for patients and caregivers. If you're interested, please reach out to us. We'll be happy to send you a free copy. This evening, we would also like to thank our sponsors who made this event possible: Be the Match, the Leukemia and Lymphoma Society, Sanofi Genzyme Oncology, Insight Corporation, our dedicated board member, John Kosnin, and our esteemed Link partners. And now, without further delay, I would like to introduce you to our speaker, Michelle Bishop. We are so truly honored to have her expertise and years of dedicated research available to us for this series. Dr. Bishop is a clinical health psychologist who has specialized in working with cancer patients and family caregivers for over 20 years. As a research faculty at the University of Florida, she spent over a decade studying bone marrow transplant survivorship and caregiving. She was project coordinator for a multi-center study of long-term BMT survivor and spouse quality of life and conducted studies of BMT couples and of family caregivers transitioning home after a bone marrow transplant. She developed and piloted a bone marrow test transplant caregiver self-care toolkit intervention, which formed the basis for the Be the Match Caregiver Companion Program. At present, Dr. Bishop has a private practice in Gainesville, Florida, where she provides direct clinical care of cancer patients, survivors, and family caregivers. She serves as an independent psycho-oncology consultant for individuals and organizations. Thank you for being with us this evening and sharing the vital knowledge needed to cope with this challenging world of bone marrow transplantation.
Thank you so much, Jennifer. And to the audience, thank you all so much for being here tonight. I am truly honored to be able to spend this hour with you and to get an opportunity to talk about some of the common themes of the BMT experience for family caregivers and discuss ways caregivers can manage and cope with the challenges they may face. Although you as caregivers play such a critically important role in helping to make this amazing treatment successful, too often your needs are not adequately acknowledged or addressed. I want to say a special thank you to the National BMT Link for championing family caregivers and for creating this excellent webinar series to address those needs. Tonight we're going to talk about some of the particular challenges that come with blood and marrow transplant, or BMT for short, and in particular focus on the experience of family caregivers. My goal for tonight is to acknowledge and validate the caregiver experience and highlight the vital need for self-care. It can be really hard and challenging to take care of yourself while caring for others, so I'm going to talk about different ideas and tools that you can use to manage and cope with whatever comes your way. I also want you to know you're not alone. There are numerous resources available to family caregivers, which we'll talk about towards the end of this presentation. So to start, the BMT journey typically starts with a cancer diagnosis, which of course is a major life stressor. It is truly a life-shattering event that can rock our world and stops us in our tracks. It affects and disrupts every aspect of quality of life, not just physical health, but the mental, emotional, social, sexual, and financial aspects of quality of life. There really isn't a domain of life that isn't affected. And it doesn't just affect the patient, of course, it affects the family as well. Indeed, the National Coalition for Cancer Survivorship and the National Cancer Institute both acknowledge this fact in their definition of cancer survivor. Because family, friends, and caregivers are also affected by cancer and cancer treatment, they're considered cancer survivors as well. So you are co-survivors, if you will. It's important to acknowledge that family members who are providing care and support for the patient are both caregivers and survivors themselves. That's why you'll find I'll often use the term family caregiver in this presentation as a way of trying to acknowledge both aspects of the experience. So we know a cancer diagnosis and conventional cancer treatment can be very stressful, but BMT treatment has some special challenges. It's a particularly intense treatment, which often involves extended hospital stays at a BMT center far from home, requiring extensive travel or time away from home. Treatment side effects can be substantial and can cause significant short and long-term effects, as well as late effects, which are the medical issues that can come up down the road as a consequence of the intense treatment. And the recovery period typically lasts longer than recovery from more conventional types of cancer treatment. So the caregiver role is particularly important in this context of BMT. Patients may need more care and more support for longer than, again, cancer patients that are experiencing conventional therapy. Studies show that caregivers are critical to the health adjustment and in some cases the very survival of BMT patients. So again, you, the caregiver, make it all possible and are really critical to the success of the treatment. Now we talk about the caregiver role, but actually there are multiple roles that a family caregiver takes on. So one such role is a patient advocate, which has several roles as part of that. So you may be the person that's gathering medical information, asking questions of the medical team, monitoring the patient's symptoms, communicating with the doctor, scheduling appointments, providing transportation, and so on. So just those roles alone can feel like a full-time job. Family caregivers are often also the messengers of information to family and friends on how the patient is doing. And sometimes they're what we call a gatekeeper. So they're the ones that are receiving or intercepting messages, well wishes, or visits from the support people to the patient when the patient might not have the energy to receive those messages directly. The caregiver may also be managing finances, home care, child care, work outside the home, and so on. Of course, especially once home from the transplant center, the family caregiver becomes often the provider of hands-on care. So that is more like a nursing role where one might be administering medication, monitoring symptoms, taking care of central lines, etc. At the same time, they're the provider of psychosocial care to the patient, trying to keep the patient's spirits up, which sometimes can be hard to do when you're feeling stressed or worried inside. So you see, it really is an awful lot. I think it's important, too, when we talk about roles, to acknowledge that these are usually new and shifting roles. They're not necessarily roles that you're familiar with to begin with or engaged in previously. So new roles might be becoming a patient advocate and learning a medical system or learning how to best communicate with the medical team. It might be learning those nursing tasks, except that you didn't go to nursing school and you're having to learn it on the job, which is really stressful. There are those added roles that maybe the patient used to do that you have to take over for a while the patient is focused on recovery. So you have more on your plate than you normally do. You might find that they're shifting roles. So, for instance, couples, married couples or life partners who were sharing tasks equally at home now find themselves in unequal roles as nurse, patient, or even it feels like parent-child sometimes. And that can be disruptive to the relationship. And all these things are happening in the context of ongoing roles, regular everyday roles, like career roles, parenting if you have kids, or caregiving elderly parents. That's the thing about cancer and BMT. It doesn't happen in a vacuum. It happens in the middle of living your life. So hopefully you're getting a sense of the unique challenges of BMT for family caregivers. Caregivers are affected directly by the cancer and BMT in the ways we've talked about, but they're also affected indirectly in that they're watching their loved ones suffer and maybe feeling helpless to do anything about it. Although they may be feeling tired or stressed, they often contain or hide their own feelings. Others might not realize what they're going through, and they might ask about how the patient is, but not how the caregiver's doing. And because the patient's unwell, the caregiver might feel that they've lost their confidant, the person that they usually lean on. All these things can lead to feelings of social isolation. And as we've said, the caregiver role is not necessarily distinguished from the family role. So unlike a professional caregiver who goes home at the end of the day, this is your home and this is your life. And so this is why we use the term forgotten survivor. It's important to understand that the BMT journey is actually comprised of a number of phases, and your role as a family caregiver may shift and change over these different phases. In the acute treatment phase, or in first 100 days, the focus is really the patient just getting through treatment and dealing with the acute side effects. Fortunately, typically there's a lot of support for the patient and caregiver from the medical team, and you might get a chance to meet other families going through BMT, which helps you to not feel alone. Most centers are very good in offering training for family caregivers for the hands-on care that they may need to do once home, but it can still be scary for caregivers to go home and have that burden of care shift onto their shoulders. So that first arrow that you see, that transition home into that early recovery phase, caregivers can experience a lot of anxiety. What family and friends may not know what's happening with BMT recovery and may expect that now that the treatment is done, life will simply go on. But for you, this next phase, this early recovery, is just the beginning. And as we'll discuss in a few minutes, it'll be important to let others know that in order for you to form the care team to support you. This early recovery period may actually last up to 1 to 2 years. Now, through that time and into the next phase of long-term survivorship, you'll likely find that you will be doing less and less over time of the hands-on caregiving tasks and more of the adjusting to various life changes that have come as a result of the illness and treatment. So it's important to understand that this process really is a marathon. It's not a sprint. And as we will be talking about, we need to be thinking about ways to build strength and stamina for the long haul. So it's important to understand what do you need to do now and what you can keep doing to take care of yourself to have this be the best experience possible. Before we go into some of those ways of coping, we'll take a quick look at what we know about the caregiver experience once home from the transplant center. Studies show that in the first year after BMT, caregivers certainly can experience physical and emotional exhaustion. And some of this has to do with all the things that we've talked about, those changes in roles and responsibilities, seeing the struggling with the changes in the survivor, and really feeling helpless sometimes to ease their suffering. Certainly the issue of unmet needs, so having trouble finding time for self and ways to cope with stress, which is what we're going to be talking about later on. That uncertainty of future and that the recovery is longer than expected, and hopefully this presentation will help you to understand what you might expect, and so that won't be an issue for you. Addressing the survivor's emotional needs sometimes can be stressful. We mentioned the social isolation. And financial worries can be of concern, which is why National BMT Link and others have developed resources just to address those financial issues. In fact, a week ago, they put on a webinar to address those. In terms of long-term consequences, studies have shown that patients and caregivers can continue to be affected many years later. So these are results from a study that I was involved in many years ago when we were looking at responses of long-term BMT survivors and caregivers. They had anywhere from 2 to 23 years post-transplant, an average of 7 years. And when we looked at the spouse caregivers, we found some surprising things, that even 7 years later they were reporting fatigue, not as much fatigue as the patient, but more than a control group of people that were matched for their age and gender. They expressed some cognitive, sleep, and sexual problems, which probably relates to the fatigue and some of those ongoing caregiving and changes that they're adjusting to. They actually reported less social support and more loneliness than the patients themselves. And in this case, the odds of depression were higher than in those matched controls, and they were less likely to be getting help. Now, I share this with you not to scare you. I think it's important that you know that this study was done actually in the early 2000s, and it was published in 2007, and these were folks that had been transplanted up to 20 years before that. So BMT treatment has really changed. Our understanding of survivorship has really changed, and the resources available to caregivers has really changed. But I wanted to still highlight it to really bring home the message of how important it is for you to take care of yourself, because it still is a marathon, and that we know from studies of chronic caregiving or ongoing caregiving that chronic stress can weaken the immune system and make people vulnerable to illness. I won't spend much time on this slide for the sake of time, but I just want to highlight 2 points. One is that oftentimes between the patient and the caregiver, we were talking about the caregiver will sometimes hide their feelings to protect the patient, but sometimes the patient does that as well, and it's something called protective buffering. So each protects the other, if you will, by not sharing their thoughts and feelings. They're trying not to burden the other. And although that's okay some of the time, it actually can create some distance or separation between the couple. And so communication will be something that we'll talk about later that's very important. The other point that I wanted to make, we talked about role changes before and during transplant and after, but in the long term, in long-term recovery, when the patient starts to feel well enough to take back some of the roles, sometimes caregivers have a hard time relinquishing the roles that they've taken on, or there can be a negotiation that has to happen in transferring those roles back. So bottom line from all these studies, these and others, family caregivers experience as much or more oftentimes distress than patients, and family caregivers are less likely to get help than survivors. So why is that? Well, there are actually lots of barriers to self-care. And self-care actually is pretty hard. Lots of different feelings we might have that keep us from taking care of ourselves. We might feel like it's selfish. Well, I'm not the one who has cancer. I'm not the one who's going through this, so I shouldn't think about my own needs. Or I don't have time. Look at all the things we talked about, all the different roles. It's hard to imagine that there would be time to fit in some self-care. Although I'm going to argue that you can't afford not to, because it's so important. There can be a feeling of, if I don't do it, I won't get it done, or I don't want to bother other people. But as we'll talk about, it's very important, and really it's impossible to go it alone. It's important to get other people involved. Sometimes caregivers will feel like they wouldn't forgive themselves if something happened to their patient if they were away. But it's important that they do take some time away, and that there are different ways to make sure that the patient is safe while they're gone. Sometimes caregivers aren't aware that they have access to help and resources. I think that's changed nowadays, particularly with the telephone and with the internet in particular, that there can be access even if you're at home and you can't, let's say, go to a support group or go to a workshop. There's a lot that you can access from your own home. An important piece, I think, is that a lot of caregivers may simply not be aware either of the importance of self-care or that this is impacting them. They're very focused on taking care of the of the patient, and so might not pay attention to different signs and symptoms that they're experiencing. And this is something, again, that we are going to talk about. So I hope I've convinced you that self-care for the caregiver is absolutely vital. The patient's health and their well-being depends on it, and so does yours. So one way to think about this is how important it is for you to put your oxygen mask on first. Now, I know this is kind of an overused cliche, but I'd like to take just a minute to really think about and understand this message. For those of you who have flown in a plane, this will be familiar to you. They tell you that if there's a loss in cabin pressure and the oxygen masks drop down, they instruct you to put your oxygen mask on first before you assist someone else. So your instinct, if that happens, might be that you want to help your loved one next to you. You want to make sure they're okay. The thing is, while you're spending time focused on trying to get that darn mask on your loved one, playing with the little pull tabs and trying to get it on right, you've just run out of oxygen and passed out. And if that mask didn't get on your loved one, now you're both passed out. And so it's not helpful to either of you for you to be that focused on your loved one. If you take a few extra moments to put your mask on first, make sure it's on properly, then you can breathe. Then you have the time you need to help your loved one, and you are much more assured that they will be fine. So you can think about it as the number one way that you can support your loved one is to put your oxygen mask on first. It maximizes the chance that you can provide the quantity, remember that marathon, and the quality of the care that you want. Okay, so now we're going to switch gears and focus on the things you can do. We're going to talk about different ways to promote strength, stamina, and resilience for the long haul, for that marathon. So these include getting information, social support, self-care, ways to cope with emotions, connecting with your loved one, and finding peace and positives. So getting information might be obvious, but it's really important and it can make a big difference. Knowledge is power. You are empowering yourself. You're empowering yourself right now by listening to this webinar. You are getting information to understand what to expect and to help you develop some strategies for the journey that you're on. That process of knowing what to expect is so important. Having realistic expectations can really make a difference. If you're expecting things to go one way and they go another, so you're thinking the patient is going to recover in a couple months and it turns out it's more like a year, that's going to be very stressful. You might not feel prepared for that. You might wonder, is there something wrong or something different about your situation? Is it normal? So knowing what to expect and knowing what is normal can increase a sense of control. Fortunately, there are lots of great resources for information. Of course, healthcare providers, the BMT team, your doctors, nurses, advocacy organizations, National BMT Link being one of those, that provides so much helpful information on what to expect, as well as support. There are websites, books, and others who have gone through it before, which relates to the importance of social support. So one thing to think about is it really takes a village. If you think about all the roles and responsibilities we've talked about in the beginning of the presentation, no one can possibly do it all by themselves. And there's no reason to do it by yourself. People want to help, and it's important to allow them to help. Don't go it alone. So it's important to create a support system for that long haul and not just be thinking about the support system during that early acute treatment phase in first 100 days, but into the early recovery phase and into the longer survivorship phase. Fortunately, there are lots of different kinds of support. There's instrumental, which is what we usually think of as people doing things for us. So bringing food, transportation, picking up our kids at school, grocery shopping, doing lawn care. Those are kind of instrumental, practical things. But there's also social support, emotional support, financial, and respite. So people can give you a break. So lots of different kinds of social support. Even there are small ways that people can make a difference. So you might feel like, it's okay, I can get the prescriptions or I can mow the lawn. But if you let someone else do it, it's one less thing for you to do, and it might allow you some needed breathing room for yourself. And that is part of that self-care piece. Now, there are many different sources for social support. And we often will think only of those closest to us, so family and friends, but it's important to kind of expand that and think about neighbors, think about coworkers, your spiritual community, other survivors and caregivers, and of course professionals. You might think outside the box. So many young people today are looking to complete volunteer hours. My son is one of them. And so, they could help with yard work or grocery shopping, and they could get community service hours, and it would help them and it would help you. As we mentioned, most people won't understand about that marathon that you're going through, so it's important to let them know what's going on and that you could still use help. And that's going to take us to this slide. There are actually some great tools that you can use to communicate with others and stay connected and let them know what the experience is like for you as it continues on without having to communicate with them one-on-one directly. So it's much easier for you, and it's easier for them because they can check in with these tools and find out what's going on and perhaps to offer help. So one in particular is called Caring Bridge. These are free websites that you set up, and you can post little messages about what's happening, updates. It could be something you just do every day or once a week, or it could be only when you see the doctor. But your family and friends often want to know what's happening, and it is a way to let them know, again, once you're home, that you might still be dealing with all kinds of things, and to help them understand. Because, BMT is not something that a lot of people go through and they may not understand. And it's a way also where they can post well wishes, and you can read them at your own leisure, and you don't have to, again, respond individually back and forth. Now, there are resources to manage help, per se, more that pragmatic help, that instrumental help. Those are websites like Lots of Helping Hands or Meal Train. So it's a calendar where you can post things that you need, and people can sign up and say, okay, I will do dinner for the family on Tuesday, and someone else will say, I'll go grocery shopping on Sunday, and they can fill it in. So again, you don't have to ask because it's hard to ask. You can post it and they can sign up. One thing, though, is, oftentimes people do say to you, well, let me know how I can help. And although it's well-meaning, it can be hard to think of something at the time, and it can feel too general. You can actually try to have a list ready in case people ask, and then you can give them choices. So if someone says, let me know how I can help you, you might respond with, actually, if you could either pick up my son from soccer next week or grab a few extra groceries for me when you're at the grocery store, that would be a huge help. So Self-Care 101. Now the point here is not to burden you, to make you feel like there are more things you need to do, but it's to make the point that it's possible to incorporate self-care into your everyday, and that little things can make a really big difference. Actually, just checking in with yourself every day is a way to take care of yourself. So often, caregivers, again, are so focused on their families that they really don't take even just a minute to kind of check in with themselves. How am I doing? How am I feeling? How am I feeling emotionally? How am I feeling physically? Am I tired? Am I stressed? Am I doing okay? just that, putting yourself on the radar, if you will, is the first step. Bringing awareness is the first step to self-care. Then there are lots of little things you can do, small things that can make a difference, things you can incorporate into your routine. And as we talk about some specific things, maybe think about how could you incorporate that into your routine so it doesn't feel like one more task that you have to take on. And think about different ways you can use reminders. What can cue you to take care of yourself, because it's easy to forget. So we'll start with physical health. I mean, physical health really is kind of the backbone of stamina, if you will. You know, we talk about, well, as long as we have our health, right? So staying strong and healthy as possible is so important for you as a caregiver. And you know, things like keeping your own medical appointments. You might have medical issues, or you want to at least prevent medical issues. And so trying not to cancel your own appointments and get preventive care. I know it's easier said than done to say, you know, make sure you sleep, make sure you eat well. But again, there are small things you might be able to do, even if it's making sure you have, you know, a piece of fruit every day, or making a choice of a more nutritious meal instead of, you know, fast food if you have that choice. Staying hydrated seems like a minor thing, but actually getting dehydrated can cause a lot of fatigue. In our self-care toolkit, we included a water bottle in the kit, partly to really emphasize the importance of hydration, but also to use as a reminder, so that the caregivers, as they're carrying that bottle, it's kind of a signal to say, hey, don't forget to take care of yourself. There are lots of different ways to take care of one's physical health, and you know, both Western medicine and alternative medicine, if you will, yoga, massage, acupuncture. Try to be careful of unhealthy coping. Of course, when we're stressed, we have a tendency to engage in behaviors that sometimes are not always the healthiest. But again, just bringing some awareness and just, you know, being careful. So coping with stress and tension, you know, stress and tension really builds up in the body, and we actually can feel it physically, right? We can feel tense, we feel achy, we feel stiff. And so it can be really important. You want to burn it off. You want to get it out of your system. So any kind of movement, it doesn't have to be going to the gym, but moving, stretching, of course exercise, but walking. There are wonderful apps now where you can do yoga from your phone, your smartphone, or your computer. You don't have to go anywhere necessarily. Thinking of a reminder, so pedometer can be a reminder. You know, now we have Fitbits. We have all different kinds of reminders to keep moving. Another way to cope with stress and tension is turning it off. So that's more about trying to calm oneself, calm the body from a state where it's really tense and aroused. It's amazing how just taking some deep breaths can really bring down our blood pressure, our heart rate, and have a calming effect. Certainly that and other relaxation techniques. There are body scans, there's progressive muscle relaxation, there's all kinds of things that one can choose from. There's a website called Health Journeys that has many, many different recordings, and some are very specific to cancer and cancer treatment and for caregiving. And again, there are also many apps on smartphones, on computers that like Breathe to Relax, or there's an app called Calm. There's an app called Insight Timer, which has something like 6,000 different relaxation modules, and these are all free. So there's more resources than there used to be. And of course, things like prayer and meditation, just taking time for quiet reflection, can be very helpful. I'm not going to spend much time on this slide in terms of signs of burnout. Actually, the first webinar of this series spent more time on this issue. But I just wanted to mention this is, again, important in terms of that checking in with yourself. And so just noticing if either different signs of something's different, something's not quite working for you. So you might be losing or gaining weight, or using more alcohol or caffeine, thinking also about sometimes physical symptoms, so headaches or stomach aches or back pain, stopping for a second and thinking, wow, is it possible that this is a sign of burnout? Is this a sign that I need to try to do something different? It can also be more social or emotional, so being more irritable or short or crying easily, all signs of burnout. And there's signs to signal to recharge, but also I would say, think about recharging as a preventative for burnout. And so thinking about what recharges your batteries. So it's really different for everybody. For some, if you're introvert, it might be time alone. For an extrovert, it might be time with other people. It might be that you like to read. It's like you like time in your garden, doing sports. Whatever recharges your batteries, whatever gives you some energy, think about that. And then think about how could you schedule that in. So not wait until there are signs of burnout and then try to kind of play catch up. But how can you schedule it in, again, for that marathon? It's like pacing. It's like knowing if you're going to go the long haul, you got to keep those batteries charged. And you can get the patient on board too. The patients often feel very guilty that caregivers' lives are being affected, and it makes them feel better if the caregiver's taking care of themselves. And you guys could talk about, okay, how can we build this into the schedule? What's a good day? How about I go to yoga class on Monday, and you have your friend Bob come and sit with you, and you guys can play cards. So build it in, and that way both the patient and caregiver can plan on it every week. They know that it's there, and it becomes part of the routine, and that helps lower the guilt as well. And even if it's just protecting 10 minutes of daily downtime, maybe in the morning before the day gets started or 10 minutes at the end of the day, even that can make a huge difference. So there are lots of difficult emotions that can come up on this journey: fear, anxiety, anger, guilt, sadness, uncertainty. And sometimes it can be kind of overwhelming, and sometimes it's an emotional roller coaster. For instance, one very typical emotional experience for all cancer survivors is the emotional roller coaster of scanxiety, if you will, of as you approach a doctor visit or a scan, your anxiety goes up. And then after the scan, you find out it's clear, it goes down again. And so it's like you have to know that you're going to be riding that emotional roller coaster for a while. So it's important to realize that emotions aren't bad things. They're really signals to pay attention to what's going on and to kind of figure out what we need. Caregivers often feel the need to hide emotions. They don't want to burden others. They feel like they need to put on a happy face or need to be positive. And it's important to understand that having those emotions, even if they look or feel negative, they aren't bad. And in fact, getting a chance to express and process them can relieve some of the stress and actually can be helpful and can help you to refocus on, the caregiving at hand. So there are lots of ways to acknowledge and process emotions. Certainly writing is one way that a lot of people do it. This way you're doing it privately if you're worried about, you don't want to burden somebody else. Writing it down, journaling. Expressive writing is something, there's actually quite a lot of research on it that shows it can be as effective sometimes as therapy. And it's writing for 20 minutes, kind of deepest thoughts and feelings, over at least 4 different times, and that there's something about writing and processing those emotions that really can be helpful. But it is important if you start to feel overwhelmed by those emotions just to stop. It doesn't have to be writing, though. It can be art, music, movement. If you think about music can really move our emotions, and it can help us, sit in a space if we're feeling sad and allowing ourselves to kind of grieve and feel sad. It can also help uplift us and give us energy. Of course, talking with others is a great way to acknowledge and process emotions. And talking with other folks who've been through BMT and caregiving is great because they get it. You don't have to explain. They know right off the bat what you're talking about, and you can just share. But sometimes it's important to spend time with friends that are not dealing with BMT, just for a sense of kind of respite and normalcy and kind of general social support. It's okay to grieve losses, that there are a lot of changes in both your lives, and acknowledging them and accepting isn't giving up. It's actually a way of kind of acknowledging and then being able to move forward. So we talked a little bit about getting extra help, and you don't have to have symptoms of depression or anxiety to think about something like professional help, individual counseling. Actually, individual counseling can be a fabulous place that's totally safe, completely confidential, a space to call your own, a way to schedule in some of that downtime, some of that me time, where you don't have to worry about burdening the other person or their agenda or their opinion. And it really can be such an incredible resource to have that, where you really can say and feel anything. And sometimes folks will build it in, just like they might build in massage or build in some of that downtime. They understand that having that particular support helps them in the long haul. Lots of people I see in my practice, I might see regularly during the more stressful caregiver experience period, but then we might continue to check in monthly or extend it out just to keep that resource in place for the long haul. Family counseling can be very helpful to address communication difficulties or issues of intimacy or sexuality that might come up. Of course, if you're experiencing symptoms of anxiety or depression, counseling can be incredibly helpful, and you also want to talk to your doctor. I am realizing that I am getting close on time, so I'm going to just mention on this with connecting with the patient that, because this could be a webinar all by itself actually, that listening and validating the patient, supporting them is important, but you also want to encourage the patient to reach out to others as well as get support for yourself. You guys are doing this together, and so one thing is to find new ways to do old things and find meaningful ways to connect. So maybe to share special memories or go through photo albums, kind of remember who you were before all of this and get back in touch. And this brings me to a very important point, which is that there aren't just challenges and stresses and losses. There are incredible gains and growth that can be experienced, gifts along the way. One of the things that has just been amazing to me in all the years of work is how resilient the human spirit is, and it's been awe-inspiring to work with families dealing with cancer because of their ability to thrive, their ability to grow, and to find positives. So there are gifts that come with caregiving. It can feel incredibly special to provide care for another, incredibly rewarding and purposeful. For both patients and caregivers, their life perspective can change, and life appreciation, and they realize what's really important. Caregivers may have an increased sense of personal strength and think, wow, I never thought I could do those things. And so they feel a real sense of mastery. People get closer to one another. They may feel more compassion for others, and they might have a stronger faith in themselves, in God, in each other, and some very powerful changes. So the last way of coping that I'll mention is that you can actually highlight those things. You can notice, look for, because sometimes it's easy to not see them and ignore them, but notice the moments of joy and beauty. Notice these special times. So a nurse that was just particularly kind, or a neighbor that came and helped you with something that you barely knew. The gratitude diary is something that some folks use that can be very helpful. So maybe every day or every week, writing down, what do you feel grateful for? Maybe it's a big thing, like I'm grateful we're alive. Maybe it's a small thing, like I'm grateful that we had this really special moment together today. So looking for moments of joy and beauty, finding meaning, and ways to give back can help you feel like there is purpose and can be very enriching. So finding a new normal, A lot of this is about putting the pieces back together. If you remember from one of the first slides, cancer shatters kind of the life experience, and there are all these fragments of colors. And yes, life is different after cancer and BMT, but it is possible to put those pieces back together. And they might not be in the exact same pattern, but they could be in a different pattern that is just as beautiful. And part of that process is grieving those losses and celebrating the gains and finding a new normal, new goals, new priorities, new ways of doing things, and cherishing the gifts that you found along the way. So I know that was an earful. I appreciate your patience. Remember that you're a survivor too. It's a marathon, not a sprint. You want to put your oxygen mask on first. That self-care really is so important. Remember, it takes a village. Don't go it alone. Keep yourself in mind and look for those silver linings. I'm just going to take a couple minutes, because I know we have questions waiting, to talk about a few resources. The BMT-specific resources, of course, National BMT Link, Blood and Marrow Transplant Information Network, or BMT InfoNet, and Be the Match Patient Services are really the three in the BMT world. And I just wanted to highlight with the issue of information on what to expect. All three organizations have some fabulous materials that really help you understand what to expect. And the Living Now magazine series literally does it from every 3 months in terms of that early recovery phase and then going into long-term survivorship. And BMT Link has a wonderful New Normal video. And the BMT InfoNet has survivorship symposiums, so as you go forward into that survivorship phase, it's a way to reconnect with other survivors and continue to get information as you go forward. I will mention the Caregivers Companion. This is the toolkit. I was part of the foundational research for it. It is a self-care toolkit for BMT caregivers, has a journal, a way to check in every day, and then there are 6 modules, different areas: social support, physical well-being, recharging, peace and positives, with lots of different ideas of how to cope. And there's that water bottle I mentioned. What's fabulous about this program is it comes with a coach. So you have an individual who's there with you, taking you through this, listening and supporting you, who is trained both in this program and in the BMT world and can provide that one-on-one support. There's nothing else really like it. Of course, there's free counseling support at different cancer organizations, and the American Psychosocial Oncology Society has a helpline to help you identify a mental health provider with cancer experience in your area. And then, of course, there are general resources for caregivers, lots of great caregiver organizations, and then the national cancer organizations have information for caregivers as well. Thank you so much.
Oh, Michelle, thank you. That was an amazing presentation. We can really hear the level of compassion you have for people going through this, and you've shared such an amazing list of strategies for coping. And yes, of course, you have some questions that have came in, and so we're going to try to just give you one or two. I know we're running out of time, and for those of you who we do not get to your questions, we're going to try to follow up with you this week and do our best to answer those for you. But some of the questions that came in, how do I handle the loss that I feel of my own life as a caregiver?
That's a good one. So, as we've mentioned, there can be a lot of losses. Loss of independence, changes in social life, loss of an imagined future together, and it can be important to give yourself time to grieve and process those feelings. So as we talked about, writing, talking to close friends, remembering that accepting those losses is not giving up. It's allowing you to acknowledge and grieve and move forward and find new ways of doing things. I think the acceptance process can also help us to see some of those bright spots and those gifts along the way and help us to shift our perspective to include both the losses and the gifts. This question though makes me think about another important aspect of this experience, and that is with all that we have to do and cope with, that it's very easy to lose ourselves, to forget who we are. Cancer and caregiving can be stressful, but they don't have to define you. So again, I know it's easier said than done, but try to remember you. Try to remember what's important to you. What do you love? If you can try to maintain or get back to those things that are important to you, that make you you, that can really help you keep your sense of identity and decrease the sense of loss.
Oh, thank you. Thank you. There's another one here that just melts my heart, and I think you will be able to help. This person writes, how do you cope when the news is not hopeful?
That is, I think it's very difficult, and I think, that really is shifting the focus from hope being about survival and kind of getting through to hope for quality of life and special time together, and thinking about what you can do with the time that you have. And it can be a very sacred time and a very special time. And so it's kind of refocusing on, for both of you, making it as special as you possibly can.
And again, great wisdom. And Michelle, thank you so much for being with us tonight. I wish we could stay on the phone with you longer. I feel like there's so much we have to gain from you, but we just thank you for being with us. We'd like to thank everyone for being a part of this webinar tonight, and we invite you to take our quick survey at the end. This will enable us to help future caregivers and survivors and make sure that we're addressing the needs that are important. We also want to make sure that we remind everyone that next week we have another webinar, not part of our caregiver series, but part of our chronic graft versus host disease. So Tuesday, October 17th from 7 to 8:30. It will help patients better understand and manage chronic GVHD. Participants will learn about emerging and established chronic GVHD treatments, effective management, symptom management, and emotional well-being. So if you are interested in being a part of that, please come to our website, register, and we'd love to have you. But we thank you for joining us this evening. We hope you learned some new skills to put in your toolbox, and we hope you have a wonderful evening. Thank you all.
Thank you. This does conclude our teleconference for this evening. You may now disconnect your lines. Thank you for your participation. Have a wonderful night.